afternoon. Welcome to today's webinar presented by Robert Wood Johnson University Hospital, Somerset, in conjunction with Friends Health Connection. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Our topic today is the Pap test, smearing myths on cervical cancer. According to the CDC, all women are at risk for cervical cancer. However, it often occurs in women over the age of 30. Today, we will discuss the causes of cervical cancer, signs and symptoms, types of cancer, diagnostic tools, the latest treatments, and prevention strategies. We are pleased to be joined by our special guest, Dr. Mihae Song, a gynecological oncologist with Robert Wood Johnson University Hospital, Somerset, and Rutgers Cancer Institute of New Jersey. Dr. Song is also Assistant Professor of OBGYN, Division of Gynecological Oncology at Rutgers School of Rutgers Robert Wood Johnson Medical School. We will begin our webinar with about 20 minutes of moderated discussion with Dr. Song, and then we will open up the forum to questions from members of our audience. So first, welcome, Dr. Song.
Thank you so much for inviting me.
We're our pleasure. Thank you for coming. And if we could maybe just start off by having you tell us a little bit about yourself.
Sure. So I did my medical school training here in New York, and then I actually went to residency, OBGYN residency here at New Brunswick, Robert Wood Johnson Medical School. So we spent about 4 years doing residency, and then I spent 2 years practicing general OBGYN. Then I just went to get specialized training in gynecology for a 3 fellowship and just came back to the area. So right now I'm part of the Rutgers Cancer Institute of New Jersey and Robert Wood Johnson Medical School, and I spend time in Somerset as well as in New Brunswick seeing patients.
Oh, wonderful. I'm really lucky to have you. So for cervical cancer, let's start off by giving our audience just a brief overview.
Sure.
Can you maybe discuss what happens in the body?
Yeah, so more than 14 million people, approximately, which is about 1 in 5 adults, become newly infected with HPV each year. So mostly teens and young adults get the HPV, which is human papilloma virus, but a great majority of these infections actually resolve within about 8 months. But for some people, some of these HPV infections can persist, and they can develop into precancerous cervical lesions and eventually cervical cancer if not treated at an earlier time, especially in patients whose immune systems are not strong enough and cannot fight off the infection.
So what is the prevalence of cervical cancer?
Yeah, so actually in the United States, it's still a prevalent problem. About 13,000 new cases of cervical cancer are diagnosed in the United States each year, leading up to 4,000 deaths each year for cervical cancer.
So who's at risk? What are the risk factors for cervical cancer?
Yeah, so because HPV is transmitted sexually, anyone who had early age of sexual activity, multiple partners, immunosuppression, especially if their immune system is not strong enough, and smoking has been found to be risk factors for getting cervical cancer.
Oh, wow. So maybe we can discuss maybe early detection. When should women start getting a Pap test? Like how often? What does this test involve, and how does it help them detect cancer at an early stage?
Yeah, so fortunately for cervical cancer, there is different ways of preventing cervical cancer, and Pap smear screening, that's actually one of the modalities that we use to screen for cervical cancer. So even after, we'll be talking about vaccination a little bit later, but screening Pap smears are still recommended for everyone. It detects precancerous cells so that we can treat it before it becomes cancer. So at the age of 21, we recommend getting a Pap smear every 3 years until age 29. Once you hit 30 and older, we recommend Pap smear with HPV testing every 5 years. And and hopefully in the near future, we could just offer HPV screening just alone without the Pap smear. And hopefully with a combination of the two, we'll be able to detect most of the precancerous cells, treat them, and then hopefully prevent cervical cancer in the future.
Great. In terms of prevention for cervical cancer, we now have the HPV vaccination, right?
Yeah.
So who should get the vaccine?
So we're very excited about this vaccine. I mean, in terms of cancer prevention, there's no vaccine like this. Actually, it was first approved in 2006 with the first HPV vaccine. It actually targeted 4 types of HPV. And then since then, actually, the company has come out with 9 valent HPV vaccine, which targets 9 HPV types. We recommend all boys and all girls around age 11 or 12 to get 2 doses of these vaccines, about 6 to 12 months apart. And the goal is to really protect them before they are even exposed to the virus. HPV actually accounts for about 90% of cervical cancer, also vaginal and vulvar cancers, benign genital warts, anal cancer. So just getting this HPV vaccine just not only protect girls from cervical cancer, but also protects males. So, we definitely recommend all boys and girls to get this before they're exposed. FDA had just approved of this vaccine up to age 45. So even if you're exposed to the virus, maybe you haven't been exposed to all types of HPV vaccine. So we recommend 3 doses of this vaccine to people even up to age 45. And that's just very exciting because it's just been approved by the FDA.
So I have 2 questions along the line. You mentioned that boys should get the HPV vaccine.
Yes.
Really, we were talking about cervical cancer today. So what does that do for boys? What cancers does that prevent, knowing they don't have a cervix?
Yeah. So, penile cancers, anal cancers, oropharyngeal cancers, a lot of the head and neck cancers caused by HPV are actually on the rise. So, protecting boys from these cancers in the future is also very important. Vaccinations here, there is a goal, to really increase the vaccination rate in all boys and girls. In past, they did a survey in 2016, and only about 50% of the girls and only about 37 to 40% of the boys aged 13 to 17 have been vaccinated. So we're quite a long way from vaccinating everybody from getting this. So, we really encourage, and especially hopefully in the next, few years, really getting the momentum of getting all parents to vaccinate their child against this HPV.
Oh, great. So what is the success rate for the vaccine? How effective is it?
Yeah. So by 2014, HPV infections responsible for majority of the HPV-related cancers have decreased, like about 71% in teenage girls and 61% among young women. So now that we're extending this vaccine to age 45, we're hoping that the impact is a little bit more, and definitely encouraging, because once you drop down the rate of HPV vaccines, we're going to see the rate of cervical cancer actually dropping and other cancers as well related to HPV.
So are there other things besides, or what other things besides the vaccine can women do to prevent cervical cancer?
So definitely getting your regular pap smears and the HPV screening, and then the vaccine. So just getting routine pelvic exams by a gynecologist really detects cervical cancer early enough to get treated. So we're hoping just, pelvic exams, going to your doctor frequently if you have any symptoms, hopefully will ensure just early detection.
Okay. Would diet or exercise play a part in there at all?
Sure. Just diet and exercise, just general overall health will be good. Just smoking cessation, because smoking is a risk factor for certain cervical cancers, are definitely ways to decrease the risk of cervical cancer.
Okay. Sounds good. Now, what are the warning signs of cervical cancer?
Yeah. So, so all women should just know just general warning signs. They first present with vaginal bleeding or just abnormal spotting, especially spotting after intercourse, especially if you've been postmenopausal for years and you haven't gotten pap smears. So these are some warning signs you could get. For advanced cervical cancer, it can present as back pain or abdominal pain. So anything that isn't improved with, just pain medications or seeing other, internal medicine doctors, you should be able to follow with your gynecologist and, get a, pelvic exam just to make sure.
Great. How do you diagnose cervical cancer? I know you said, the signs are bleeding, but how does somebody get diagnosed with it?
Yeah. So usually when patients present with vaginal bleeding, the gynecologist will do a speculum exam, a pelvic exam, and usually if there's a visible mass there, we will get a biopsy. So definitive diagnosis is by biopsy, and pap smears occasionally can detect cervical cancer. Usually we use pap smear to detect precancerous cells, But in some cases, if it's very small or, we have to do the biopsy colposcopy. So those are other tests that we can use to diagnose cervical cancer.
Okay. So unfortunately, if somebody is diagnosed with cervical cancer, then what are the treatment options available to somebody?
Yeah. So it depends on the size and what stage of cervical cancer it is. But for early stage, if you were detected early enough, we offer surgery, which includes hysterectomy, taking out tubes and ovaries, and possible lymph node removal. But unfortunately, if the cancer had progressed, we do offer chemotherapy in conjunction with radiation therapy to really treat that cervix. If it had spread above the pelvis, especially into your lungs or supraclavicular like nodes up here, then we do offer chemotherapy for that. So there's definitely different and many modalities of treatment that we do offer for cervical cancer.
Okay. Very nice. Now, through Rutgers Institute of New Jersey, patients will also be able to participate in clinical research studies. So what type of research studies are currently underway in the area of women's cancers?
So I'm very excited to be a part of the Rutgers Cancer Institute of New Jersey because it is one of National Cancer Institute's designated cancer centers. It's very comprehensive, and we offer that at Somerset as well. Different clinical trials. So we know that the standard treatment for a lot of these cancers come from successful clinical trials. So right now we currently have phase 1 trials that really looks at the side effects and the best dose of WEE1 inhibitor as in conjunction with radiation and chemotherapy. So, our phase 1 program at CNJ is actually very strong. We have a dedicated team just monitoring patients on these new drugs that hopefully will eventually become part of the standard treatment. So one of the trials look at WEE1 inhibitors to really see if we could block some of these enzymes needed for cell growth. And then radiation, as you know, uses really high energy X-rays to really kill the tumor cells. And then chemotherapy also, help kill those cells or stop it from growing. So we're hoping that the combination of the 3 drugs may work better in treating cervical cancer, vaginal cancer, or uterine cancer.
Thank you. What are the benefits for patients in participating in these clinical trials?
Yeah, so clinical trials are, research studies in which, patients may volunteer for. And again, as I've said, like all the successful treatments that we have for cancer are based on results of past clinical trials. So just participating early, especially when you've, gone through a standard treatment, there's not that many approved drugs are out there. Clinical trials are the best way to really target your treatment according to your tumor type or your genetics, and you get the most advanced medicines that are available out there. So we do encourage all patients to really consider clinical trials when you've exhausted all past options or you're looking for kind of like the cutting edge research opportunities out there.
Well, wonderful. Thank you very much for that explanation. We would now actually like to open up the webinar to questions from our audience.
Sure.
So if you are online, you can just go to the chat section and type in a question that will filter down, and we'll be happy to answer any of your questions. So Dr. Y, I know they're filtering in. I'll give them a chance to filter in. What role does genetics play in cervical cancer, in getting cervical cancer down the road?
So genetics, play a very important role in terms of like for other cancers such as breast cancer, ovarian cancer. In cervical cancer, genetics may not be the first person that we refer to, but if you have a long history of just gynecologic cancers, we may refer them to genetics just to get a little bit more detailed family history and possibly offer other testing that may be relevant to cervical cancer.
So one of the first questions in is maybe if you could talk about or explain what resources our hospital offers and or might be in the community for somebody who's been diagnosed with cervical cancer.
Sure. I can talk about both Somerset and New Brunswick, but Somerset actually offers a great number of programs for people with gynecologic cancer. Steeplechase is a beautiful, just cancer center that has everybody actually in one place. So it's really easy for patients to get around from one specialty to another. You know, I'm in Chase as well as radiation oncology is on the first floor. We have medical oncologists, you know, right on the same floor. We have patient advocacy. We have the boutique store, especially on the first floor, that you could get fittings. If you have lymphedema, if you need a bra fitting, especially for those with breast cancer. It's a wonderful place just for patients to get plugged into. We have geneticists who come here about 3 days a week just to offer free genetic counseling to patients on the same site. We also have the hospital, which is right next door. So, you know, we also have clinical trials, especially in the same building, so patients don't have to go travel so far to another hospital or to another county. We actually have it right here. So, you know, Somerset is very fortunate just to have a great research team that really connects with the patient individually and offers all these great trials in conjunction with CINJ as well as medical oncology. So it's really great just to have everything in one place so patients feel like they could really connect with other people.
Thank you. Yeah, I know at Steeplechase they offer a variety of support groups, and
Yes, yep.
there's you know, mind-body exercise classes to help reduce some of that stress.
Yes,
Resource
yes.
library. So there's also, you know, a lot of other services that you know, our patients can take advantage of.
Yeah.
So I know throughout our conversation you have mentioned CINJ. So maybe you can explain the relationship that the hospital has with CINJ for those who may not understand that.
Sure. So CINJ is, you know, the National Cancer Institute's designated cancer center. So you had to have a lot of resources combined to actually get the designation. So we're very proud of that designation. And we do offer a lot of the same resources that Somerset has, but also in New Brunswick. And because I'm part of both Somerset Hospital and Cancer Institute of New Jersey, we have the same resources at both sides. So, you know, patients don't really necessarily have to go all the way to New Brunswick for everything, but you could get the same kind of treatment as well as, you know, the expertise that our cancer doctors have, the tumor board. We have, you know, multidisciplinary meetings, both here at Somerset as well as in New Brunswick. So it's really beneficial for patients just to have access to both. So if there was a trial that we didn't have here, they would also be, you know, accessible to patients at New Brunswick, and they didn't really have to seek out, you know, different health systems. It's part of the same group, so it's really convenient for patients.
Okay. I mentioned you said that you work at both. Do a majority of doctors work at both here at the hospital and CINJ?
Yeah, so we have a breast cancer doctor, Dr. Potovin, who is also part of CINJ as well as Somerset. So she sees patients here. So there are some doctors, and I know we're trying to get more doctors from CINJ to come here to Somerset as well. So there's a really good collaboration and working relationship between the two hospitals.
Okay, great. Now, I guess you kind of touched base upon, you know, what's the best way to prevent cervical cancer, but what is the best way to protect against it out of, you know, all the suggestions you had mentioned before? What do you feel is the best way?
So I think just prevention is key here. This is, you know, one kind of cancer that we can prevent with screening tools. So, you know, vaccination is something I, you know, definitely encourage patients, and not even just patients, but, you know, to all parents, to their kids, just, you know, getting more information of the vaccine, talking to your doctors about it, especially your pediatricians. And if you're older, especially when you're like 43, 42, you've never heard of, you know, the vaccine, you've never gotten the vaccine in the past because it wasn't offered then, to really just talk to your doctors about it, to say, you know, to be proactive in getting the vaccinations. That's 3 doses. And that's one of the best ways to prevent cancer and even benign genital warts. So, you know, it acts both for benign as well as for cancer. So that's one way. Another way is just to get regular checkups. I know gynecology is not, you know, the most comfortable exam of getting public exams, but in order to prevent this kind of cancer, especially if you have symptoms of bleeding or pain, back pain, to really go to your gynecologist to get an exam. And then lastly, pap smear with HPV testing is very important. We know it's every 3 to 5 years, depending on how old you are, but, you know, so pap smear with public exams and vaccinations are the best way to prevent. Of course, we always encourage people, you know, to exercise, you know, to have good good diet and stop smoking. Those are things that we could also do to prevent cancer.
Okay. So we briefly talked about the effectiveness of the vaccination. And, the question is it effective? If you could just kind of re-highlight or discuss the effectiveness of that vaccination. Again, what is the effectiveness?
Sure. First of all, the vaccine has been proven to be safe, very tolerable, not too much side effects from it. So, the vaccine has been, in 2014 has been shown that it decreases the HPV infection in young women and adults about 70% to 80%. And it's very effective in just decreasing that amount, especially because HPV accounts for about 90% of cervical cancer. So if we could decrease that, then, the chances of getting cervical cancer down the line is very important. So, patients hopefully are getting less of those precancerous lesions and then treated, and hopefully cervical cancer can be prevented one day. So we're very excited and hopeful for this effective vaccine.
So how much does lifestyle take into account your risks for cervical cancer? So, we talked before about genetics and then lifestyle. So if you had to kind of, give a percentage of how much really, genetics impact and how much lifestyle impact, what would you kind of suggest or say?
So, some of the risk factors we talked about cervical cancer, like multiple sexual partners, especially those with high risk sexual behavior, early age of sexual activity. If your previous partners had HPV infections, those would increase your risk of getting HPV infections. Your immune system, if you're on having HIV kind of suppresses your immune system, or having transplants can suppress your immune system by being on those drugs, can increase your risk of having persistent HPV. So maybe modulating those, risk factors will hopefully decrease your risk of getting, cervical cancer.
So then lifestyle is a bigger part.
Yes, than genetics. Yeah.
Right, into your risks for cervical cancer.
Yeah. Yes.
Very good.
Yeah.
Well, I think I got all the questions from our audience.
Yeah.
So having said that, this will actually conclude today's webinar. We thank you all for joining. Please remember that the opinions shared here today by our medical expert are not a substitute for medical advice from a physician. If you have or need a physician, please call 1-888-724-7123. For more information about Robert Wood Johnson University Hospital, Somerset, please visit www.rwjbh.org/Somerset. Thank you all for joining us today. Thank you, Dr. Song.
Thank you.
Hope you found today's webinar very beneficial.